Hello, everyone. Welcome to Behind the Mask, the uncensored story from your dentist. Today we have Dr. Neha Goyal with us. Welcome, Dr. Neha.
Thank you so much. It's a
Uh,
pleasure to be
so,
here.
Dr. Neha is a, principal dentist and founder of Advanced Dental Clinic in Vivek Vihar, East Delhi. And she's someone who's not just fixing up the smiles, but also running a very super efficient and tech-savvy practice. So let's go back in time and how did you become a dentist? Want to hear that story?
Okay. Becoming a dentist was a typical Indian arranged marriage. My first love was definitely mathematics, and I wanted to become an engineer. But like how it is in Indian conservative marriage families, I was not allowed to do it, and I was forced into dentistry. So it was a forced arranged marriage. But then gradually I fell in love, and thankfully it's a happy one. So,
Okay.
yeah.
Great. So let's go back. So which year it was when you were in, when you have done your BDS, which is was it?
I joined BDS in 2005, finished 2010. I was a housewife for 4 years after. I practiced for 1 year during my internship. I was working at a private clinic side by side. Then got married in 2011 and quit dentistry.
Okay.
Resumed work in 2014 again. Practiced under somebody for a few months and then started my practice in 2015. So
Oh,
from 2015 till here, it's been a blissful journey.
okay. Great. Do you miss something from your college days, your friends? Are you in touch with them?
Yeah, I'm in touch with a lot of them. But what I miss the most is chai breaks that we used to have and bunking, they call it, go there. And then now everything is there, but it's just monotonous.
Right.
Earlier it used to be fun. हम एक हाथ से हम लोग दांतों पे carving कर रहे हैं and then दूसरे से we are having our lunch also. So there was no hygiene, there was no sanitization, nothing, but it was fun.
एंड अभी ऐसा हो गया है कि कुछ चीजें वी टेल पेशेंट्स की नॉट टू डू। उस टाइम कॉलेज में शायद
Oh
ऐसा
my
नहीं
God.
था कि कोई टोकने वाला नहीं है तो वो भी
There
है।
were too many things like college with the dentist, if it was not fitting, we would give them adhesives also. So it was fine because we had to get rid of the patient that day.
राइट।
But now we can obviously not do that. We are answerable to our patients.
यस।
College में we would very अभी हम बहुत sternly patient को बोलते हैं no coffee, no chocolates. But अभी छुप के खाते भी हैं तो coffee
राइट।
के बिना we cannot end our day only. So
राइट। राइट। So I was reading something about dentophobia. Okay, the fear and anxiety patients में जो होती है towards clinic में जाने के regarding, and there were some interesting stats. So around 70% of the people have some kind of fears. Okay, and I mean आपको पता ही होगा top fear जो the top three fears जो हैं, one is the sound of the drill. Okay. Second one is the needles and the anesthesia injection and loss of control while you are in the chair. So many patients fear that when the doctor is doing something, the chair might fall or the instrument might hurt their mouth. So how do this modern dentistry take care of this phobia and how you personally take care of the patient anxiety and the fear?
the things you're talking about, they're like ancient times now. Gone is that era, gone is the era when dentistry was painful or scary. Now it's a total comfortable journey. More, our patients feel like they've entered a spa. I mean, the first thing that we do is give them a calming tea and they would soothe down, and then the entire journey is very smooth. So there's no drill noise. They get these headphones with the covers on for sanitization purposes, obviously. Injection से पहले sedation machine like a laughing gas लग जाता है, so they're cool. Fear of falling down, no, they are absolutely in control there. We would tell them to raise their hand and stop, and I guess I am more anxious than them that उनको pain ना हो जाए. So it was a different era. Now it's very comfortable. They'll have Netflix with them. They'll have entire control. They get soothing balms after the process is complete. Music will be there, and you remember that peculiar smell that used to be there in dental
Yes.
clinics earlier.
Yes.
Now the I think it's the most important thing that we take care of in the practice, and the clinic should absolutely smell amazing. Yeah,
Okay.
I hate your smell.
I have heard from few of the dentists that sometimes, patient might, fell asleep as well. So they're into anesthesia, they fell asleep and their treatment ho gaya. And then they just wake up and they're there, everything's fine. So,
I, we laugh so much when this happens, but initially I used to be scared, like what to do? The patient has fallen asleep and they're snoring. But now we sit back and think that this is the biggest compliment that the patient is absolutely relaxed, they're enjoying and they're sleeping, and we can do whatever we want. It's a
yes,
better patient name in सकता है. I wish every patient sleeps on the chair.
right, right.
But yeah, some
Um,
amount of control is also required. Patient answering us for the questions that we need to ask.
And also one more interesting fact that women are more anxious than men, but women are more proactive towards the oral care. So what do you have to say about that?
So you're talking to a feminist, so this is a very wrong question. I guess more men have cried on the chair than females. Females are still used to of anesthesias and pain because they've gone through labor and a lot of
Right,
things. But
right.
for mostly men, dental like the LA is the first injection they're getting in their life. Maybe बचपन में कभी लगे होंगे vaccination or
जी.
otherwise after that this is the first thing they're getting in that. And they would cry and they would be like they're holding their wife's hands and I'm like, dude, what are you doing?
Okay.
Okay. Yeah, but yes, definitely females are more proactively taking care of their hygiene. And but I guess things will change
Okay.
slowly. We're creating awareness and things will change.
Okay. What is the funniest excuse a patient has given you for missing their appointment?
So there are several. Sometimes we talk in the clinic that we need to create a book. We need to write a book of excuses and funny incidences that have happened. But yeah, I would just recall one incident wherein the patient told me that my maid has fever. I was like, "What? Your maid has fever? What does that got to do?" Like, no, now I have to cook.
Okay.
Remember a patient telling me, "My sister got her periods."
Okay.
So I was like, "Your sister got her periods. Why are you supposed to be at it?" No, I am her comfort partner. Okay.
That's very unique. Uh, all
Every day
right.
we come back from the clinic with a lot of stories, and
Gee.
if I start writing a book in 10 years, I'll have a thick book.
No, you should, I think. You have a lot of material for that. All right, so let's talk about some, dental awareness, especially toward, for the kids. So there is a question like, I mean, baby teeth falls anyway, so do cavity even matter for them? So,
But your baby teeth are a GPS for your permanent teeth. They guide where your permanent teeth are supposed to erupt. So yes, you are supposed to take care of them, and you cannot be in pain for even one day. How do you expect the kids to be in pain for that long? If the
right,
tooth has to fall off in 2 3 years, they cannot be in pain. It affects their digestion, their eating habits, their breathing habits. So
right.
they definitely need to be treated.
Okay. And at what age should parents, really start bringing their kids to the dentist?
This is a wish. I wish every parent brought their child to the dentist before the first tooth erupted or as soon as the first tooth erupted. But this is India. Sometimes people are visiting. Their first visit is at 60 years of age.
Hmm.
So it's just a wishful thinking that 5 साल के इससे पहले भी आ जाए तो we'll be very happy.
Hmm. All right. If we brush, then cavity, can heal automatically with just only brushing. So is it true?
No, that is not true. There are a lot of other things that impact what causes cavities. There's microflora and eating habits, definitely. But what kind of food you're eating, your gut health, a lot of things determine that. So no, it is not like that.
Okay. All right. So you are mainly into cosmetic dentistry. So let's talk about that. So what exactly does cosmetic dentistry include? Is it just teeth whitening or it's veneers or I mean what else is there?
I guess dentistry now includes everything, starting from teeth whitening, which is the basic procedure, or I would say even teeth cleaning, uh, till up to full mouth rehabs. That is also cosmetic dentistry. There are a lot of procedures. We are doing varnishes, we are doing fluoride treatments, we are doing, and we are treating fluorosis, white spots.
Hmm.
There are a lot of things that is going on. Depigmentation, we are doing laser depigmentation for curing black gums, dark gums, and there's no end. people are more and more becoming aware of how they want to look. And especially post pandemic, it's the Zoom era, and people look at their teeth from this close, like less than 5 inches, and they're conscious now. So, yeah.
So
It also
cosmetic,
includes aligners and braces.
okay.
Aligners,
So
braces, alignments.
right.
Yeah.
So cosmetic dentistry, when we say this word, so mostly एक notion है कि only celebrity do that जो page 3 पे रहते हैं. But I think trends are changing. So what do you have to say about this?
It's becoming bread and butter for us now. We are doing smile makeovers and cosmetic dentistry day in and day out. So it's not that. It's that era is absolutely gone. It was 20 years back.
All right, so let's talk about some myths and facts. So removal of tooth affects the eyesight.
Only if the dentist pulls out your eye along with the tooth. No, it doesn't affect.
Okay,
It gets numb for a while. That's it.
okay. Charcoal toothpaste whitens teeth naturally.
It can only whiten your sink. Nothing else.
Chewing gum after meal can replace brushing.
I would rather say replace your meal also with the chewing gum only. No, it cannot replace.
So let's have some rapid fire questions. So, uh, what is the most common mistake that people make after brushing?
They rinse after, right after brushing. They don't let the toothpaste work.
Okay. One dental myth that you wish should disappear forever.
Scaling is harmful for your teeth. I wish if I get a penny for every time I've answered this question, I would be a billionaire by now.
Okay. What one food that you secretly love, but you want your patients to avoid it?
There are two, coffee and chocolates. I'm sorry.
Okay.
Don't show it to my patients.
All right. Which hurts more, a wisdom tooth extraction or patient no-show?
Definitely a no-show. Wisdom tooth gets anesthesia. No-show doesn't give me anesthesia.
Okay. What is that one liner that you say maybe 10, 20 times every day in a clinic to your team, to your staff? What is that takiya kalam?
मुंह खोलो. Even to my kids, मुंह खोलो बेटा.
All right.
I don't know
Uh,
what it is.
if you had to describe your dental journey as a movie title, what would that be?
Let's call it the accidental dentist.
A smile makeover or pain relief, which gives you more satisfaction?
Smile makeover, definitely. The before and after transformation, the smile on the patient's face after the transformation is done is just heartwarming. It holds, well, they become our memories for life.
All right, now let's talk about your practice. So, when did you realize? Because dentistry is not just about managing, just the treatment. It's about managing those emotions, the chaos, the patient. So, when did you realize that dentistry is more than just it's more than about teeth?
Right on the first day of the practice, and I realized I was never taught how to run a practice. I was only taught how to drill,
Mhm.
nothing else. And running a practice, clinical dentistry is just like 30-40% of the work. A
Right.
lot of work is done behind the scenes. So we were never taught practice management and how to run practice. So that's when Best Office came in handy and it helped a lot.
Now, what part of being dentist still gives you butterfly even after all these years of practice?
When on the final day of the treatment, when the patient's transformation is done, and they would look at their smiles and they would smile, and most of them would have tears in their eyes. And then that still gives me butterflies. We'll still hold the camera behind the patient and record those moments. We'll never post them, but we still record to keep them as our memories.
Right.
They're awesome.
Okay. If a genie offered you three wishes for your practice or maybe in general, what three things that you ask for?
Not having any more no shows.
Okay.
uh, a diary that is full. I only want to work 4 days a week. So I want a full diary for 4 days. I don't want to work more than that. And I never want my patients to call me after 4 p.m. I'm done after 4. My brain is switched off. So dentistry should end after 4 p.m. Third would be a team that is thoroughly trained and is more like a family. which I already have. So I don't need a genie for that. But yeah, I wanted to stay with me forever.
I
My
think for
team is
no
my
show
biggest
as I
blessing.
think for the no show as well, you don't need a genie. I think Bestosis can help you in managing that as
Uh,
well.
it does help
uh,
a lot. Yeah.
right, right. Okay, so let's talk about a few things about Susie. Everyone should visit their dentist 6 monthly, do two scalings every year. So how do you ensure that this happens in your clinic?
When the patient is leaving on the last day of their appointment, we book an appointment for them on their sources up for 6 months later. That way, they have a reminder, we have a reminder, and we call the patient after 6 months. When
Okay.
so no cycle is missed. They are in a loop always.
But so I don't know if you know this, but Bestosis also has this feature called as membership. Okay.
Yeah.
Yes. So in membership as well, I mean, we have it has shown good results for many dentists where we can ask patient to become a member at the clinic, and they can visit, avail these offers, and so on. Uh, all right. So how do you ensure that your patient don't slip away from their treatment journey? Because many times it happens that treatment starts, but in between they disappear or they cancel or miss. So how do you handle this scenarios?
But then the best also have that feature of tracking the treatment plans creation and what all the patient has accepted. So
Right.
whenever the incomplete treatment plans show on my software, we can track them and we can call them and tell them.
Great.
It ensures that it helps a lot.
All right. So I think many viewers will be watching this, podcast, including, young budding dentists. So any advice for, practices, budding dentists, that it's not just about clinical, there is a mental aspect of itself as well. So any advice for them?
I would just say keep learning. Don't stop anywhere. The more you learn, the more you'll grow. And it's not just clinical dentistry that you need to learn. You need to learn practice management also. So they both go hand in hand. Every year, take up one clinical skill and one practice management course, and just keep doing that. That is what I've done throughout my journey.
Okay. So I think this is it. So thank you, Dr. Neha, for your time.
Thank, thank you so
So
much.
I hope you enjoyed the session, and I hope the viewers will get a lot of insights from this. So thank you.
Thank you so much, sir.